Well, good afternoon. I appreciate you being here today for this daily update. We touched on several points today. Some of you heard remarks that were made during the city council meeting, but I'll first just start by making a couple of remarks about test kits, because that's on everybody's mind. There's the belief that, the more we test, the more data we have, the more informed decisions we can make, and that's absolutely true. Today, believe it or not, we found somebody that has not been in the loop that has test kits and has a possibility of providing test kits in the near term, and I'm trying to connect them with a hospital. It's one of those unusual stories where it's somebody that grew up in Mobile and has a business elsewhere and was thinking about his hometown and reached out, and we're trying to connect those dots. Point being, though, is that we are testing more people today through the hospitals and the health clinics than we've tested in the past. All of it has to be referred by the hospitals, be a patient of the network of the hospital or either a patient of the health clinic. That will change as more kits become available, and we believe that there will be more kits available by the end of this week and certainly into next week. When it comes to the coronavirus, you're hearing it time and time again, but I would feel like I'd be derelict of duty if I didn't just continue to remind you of what you should be doing as an individual, and that is, when you're out, make sure you keep the social distancing, wash your hands throughout the day using sanitizer that's available. Those are the things that it's just got to be a way of life. One of the things that you may or may not notice, if you see pictures on Facebook or you see them on Instagram of the mayor, is you won't see anybody in the room with the mayor, pretty much. We have told all the executive directors to try to conduct all of their meetings telephonically, and that's starting to happen now. And that is trying to set the example for the companies and the individuals to do that also, because there's this belief that maybe it won't happen to me. Well, that's a false assumption, because it can happen to anybody, because you never know who you may bump into. So point is, use the telephone, use social media and other forms to reach out to people, and we will all be safer. Today I want to thank the City Council for approving the waiver of late payment penalties for the months of February, March, and April regarding the collection of sales and lodging taxes. I think that's a great stride in the right direction of trying to help businesses, but also we have made tremendous strides in the things that we're doing to make it easier for the citizens of Mobile to interact with the city when it comes to just doing business with us. And as we went through our 2 o'clock briefing call today, I'm amazed at what the senior directors are doing and the department heads are doing, working with their people to make sure that we can continue to provide services to you. We continue to follow the guidelines from put out by the CDC and by the state health department, and we will continue to do that. So having said that, I'll be glad to answer any questions that you may have. I think they would rather me not name them right now until we actually have the kits here, but they think they can have 1,000 kits here by the first of next week.
Those would go to the hospitals?
Yeah, it goes to the hospitals. It needs to go to the provider, because once you get the kit and you do the test, somebody's got to follow up with information.
Is it conceivable, because I know the meeting this morning, you said that the tents that you've set up at LAD and the fairgrounds, those would be in conjunction working with
Absolutely.
at some point. So
yes.
Is it conceivable those tests that might be coming in could be used in these drive-through sites?
Correct. What we were trying to do is provide a service to the hospitals and the clinics, and that is by us standing up a location, a central location, where their customers and our citizens don't have to go to the hospital or go to the emergency room to be tested, because they're just overloaded. And if they're not overloaded today, just imagine 10 days from now they will be. So if we can set an off-site location up, have it operating smoothly, we're going to benefit the hospitals.
With the understanding that a test that comes from a particular lab has to be tested at that lab.
That's correct.
What's the turnaround time are we talking about for these 1,000 kits?
That is.
I would repeat his question.
Okay. So your question was that if you have a test kit that's produced by a particular lab, it's got to go back to that lab to be tested. And let's just say if the lab's in Atlanta, or if it's in Mobile or Birmingham. So you get the test kit from one of those locations, that lab, and yes, you take the sample, probably put it on dry ice or something to keep it cold, and then you UPS it or FedEx it to that location. And the lab I was talking to today said that they believe that within 16 to 18 hours, they can do a turnaround where if they're their system is connected to the hospital system, the hospital can look in and see what the results are for this test without them having to ship all that back. So a much quicker turnaround. And Dale, that's evidence of what is going on. Everybody is looking of ways to shorten the testing procedure, the turnaround time, how long it takes to read the test, and so you will continue to see an improvement in that.
Any idea what the economic impact is going to be? I know somebody was asked you yesterday
So,
about what.
Yeah. So you're asking about the economic impact of, let's say, I'm going to just talk about Mobile. And I'm not going to talk about what the impact is going to be. I'm going to tell you about the city's cash flow, and meaning how much revenue we take in every month and how much we expect to take a hit on, and then do some projections from there. So based on not very sophisticated numbers, but the best numbers that we have, we think that we could be looking at a $7.5 million, a $7.2 million decrease in revenue, and typically on a monthly basis we have about $23 million of revenue. So that's roughly 30% that you'll be down. So if you think about that, so if you have that kind of deficit, you're either going to do one of two things. Either you're going to cut expenses by $7.2 million, or you're going to draw down on your reserve fund. And so with those numbers, that would mean that you have roughly, if it's $42 million in the reserve fund, you have about 6 months that you could draw down on the reserve from if those numbers were fixed.
So you guys don't plan to cut city services? Obviously, if it stretches more than 6 months, you guys may have to start cutting city services.
No, you don't wait for 6 months for it to happen. If you project out that it's going to last longer than 6 months, you start doing things today so that you don't get caught short, so that you can make it to month 8 or month 10.
Are you doing any of that currently, cutting any city services?
All we're doing is contemplating what the future holds, trying to do projections so that we don't get surprised. Yeah.
What is the surplus you mentioned this morning? 42 million? Was that the surplus?
Yes, it's not. It's a call it a rainy day fund. Yeah. So there's $42 million in it. Yeah.
Could you give an update on I know that the city announced an agreement with a local lab, and I think it was like 10,000 kits maybe by the 1st of April. Could you give an update on where
So,
with that? Or if there's
and my conversation with them is that they are still waiting for the manufacturer to fulfill their part of the deal. Okay. So they're really, all of these laboratories are at the mercy of the manufacturers. And keep in mind, the manufacturers, in a lot of cases, especially for the swabs, are either in Italy or they're in China. And so you have the challenges of overseas shipments and getting through customs and so forth. But yes, they're still hopeful that around April 1st that they'll be real close to being in business. Yep.
Are you working to get personal protective equipment as well? Because we were hearing from the health department the concern wasn't just like the swabs and the test kits, it was also the PPEs, the personal protective
Yes.
equipment for the nurses and for the
Yes.
care workers. Is that also something you guys are trying to help out with?
Yes. Believe it or not, we have 2 local companies that believe they have access to PPEs, the personal protective equipment, that we have not heard about previously. And So we sent that information to all 4 hospitals plus Franklin Health Clinic in order to give them an introduction, because what happens in that supply chain, the manufacturer of the PPE may be dealing with the purchasing department, and the purchasing department's got rules and regulations they've got to follow, they're following. So they're probably not looking at new suppliers. But if you have an opportunity to talk to the CEO and tell him these people have it, he will call the purchasing agent and say, hey, forget that procedure, we need the PPE, let's buy it.
You're seeing a lot of businesses also being shut down right now, or like closed because of health orders. And some of those have actually donated some of their items. Would it be nice to see a lot more businesses that maybe aren't going to be using some of their maybe masks or gloves to see those donated to local hospitals?
So your comment was that, are we seeing a lot of businesses that are shutting down, donating some of the materials, like especially the personal protective equipment, to be used by first responders or hospitals or whatever? I don't have any way of tracking that. I've seen a couple of emails that some of the construction companies have masks, and that they're certainly willing to donate them. But that's where the market, the relationships, and people they'll connect with each other. We're not trying to coordinate that effort. If we're told that somebody has it, we'll send it out, but we're not trying to actively make that happen.
But do you think it would be good for business?
Oh, absolutely. Yeah, I mean, a lot of these businesses have storerooms and stuff's been on the shelf for a year and hadn't been used, but it may be very necessary right now for our first responders or somebody else. And that comes back to us, working together, trying to help one another. And that's how we'll punch through this.
Do you have any comment on the employee with USA Health that was diagnosed with COVID-19?
Do I have any comment on the employee that was diagnosed that was working with the health center? I do not. Really think that that's all protected under HIPAA, and so they're not giving that information out. And I was made aware of it, but I have no comment about that.
The $7 million figure, the shortfall, that was for March. That's the projection for the loss in March for the city.
Yes, and yes. So if you really look at the real impact economically, let's go back about 2.5 weeks. So pretty much all of March will be negatively impacted. I mean, you may have had a good first week, maybe, but I think, and we're not 100% sure the 7.2 is right. That is an estimate.
That's what Paul was estimating for April as well.
That's correct, yeah. But the thing that could change that is that if we were to go into a complete shutdown or stay at home situation, that number could double overnight. So instead of having a $7 million loss, you could have a $10 to $14 million loss. And so then your safety net is starting to erode. And so what does that really mean to you? And so for the citizens, what that means is that we have a cushion. We're going to be operating as frugally as we can, but we've got to be able to pay the policemen, the firemen, the garbage truck drivers, and the essential services. And those are the things that are going through our mind, is that how do we continue that, knowing that we really can't predict how long this is going to last. And also, and I made this comment at the city council meeting, there are things that we have to spend money on or you won't be able to provide the services. So the day we buy a new garbage truck, somebody will say, you shouldn't have done that. Well, when I weigh it in the balance, if we have a garbage truck that burned up and we can't pick up the garbage, then you start having another set of problems. So we're going to continue to operate the business, and it's not business as usual. It's very unusual. But we've got to be able to make judgment calls with information that we have. And that's where we are.
This may be really early. During hurricanes and things, before hurricane season, there's always there's sales taxes waived for different places, Alabama. And
correct.
During the holiday, has there been any discussion to do that for people so they can stock up on any items? I know it's too late. A lot of people have already stocked up.
It is a little bit early to be talking about waiving the sales tax right now. And but we're recognizing that business will need to be stimulated in some form of fashion. We're going to be looking at that because really and it's not about the business, it's about them putting their employees back to work. And that's why you would do it, is to so that they can meet payroll. But yes, we'll consider that. I'd like to, and if there are any more questions, if not, I've got one more remark I'll make, is that, as I said, I believe I said this yesterday, our hospitals and healthcare workers have the highest priority, followed by first responders and those that, like sanitation workers. But when it comes to the wheels of government, it's very easy for government to create a situation where you shut a business down. But government cannot start a business back up. Government cannot start a business back up. It's got to be an individual who's willing to take a risk, and typically they can be doing it by borrowing money on a credit card, they can be doing it with money that mom and dad left them, or whatever the situation may be. And so as we fight to make sure that people stay healthy, we can't forget that part of their health is their employment, unless you're retired. And so we appreciate all the emails, the text and information that people are sharing with us, the advice that they're given, and we're not making any decisions in a vacuum. And I can assure you the people that are at the table, it's a very diverse group weighing these decisions, diversity of age, diversity of color, diversity of thought. So thank everybody for sharing what they do. And I appreciate the media doing what you're doing, but I will tell people that they may be better off walking around the block than sitting around watching TV all day long. Thank y'all very much.